Now coming to the next important topic is the pacemaker. What is a pace? So for that, you should have a fair understanding of the conduction system of the heart. Here you should be knowing the physiology of the heart. What happens in a heart? How does a beat form? Where does it get initiated? I hope you all remember the SA node or the sinoatrial node, which is a natural pacemaker of the heart. If you see the pathophysiology of the heart condition, there are so many conduction disorders or aberrant pathways, meaning the conduction has to begin in the SA node and then it has to go via the AV node, or then from the AV node it goes to the bundle of hairs, and from the bundle of hairs there is a system of branching fibers called as a Purkinje system or the Purkinje fibers, right? Now, so this is a channel through which the contraction of the heart takes place. Imagine if there is any anomaly or any abnormality, what happens is there could be like ectopic beats, that means extra beats, or there could be, the conduction comes back in the retrograde fashion. Instead of going in the anterograde forward way, they come back again back. So what happens is all these cause a conduction disorder of the heart resulting in arrhythmia. In order to treat that, surgeons have employed devices